What is the incidence of dementia in Japan?
Oh, it's increasing, and recent epidemiology study in Hisayama cohort in Kyushu identified maybe 15%.
Already.
But it depends on the definition of dementia.
You were talking about the incidence around the world and developed in developing countries. Maybe you can briefly repeat what we were talking about in this session prior to our discussion. So, first of all, what is the incidence of dementia around the world, and then where do you see the difference of the challenge of dementia in the developed and in the developing world?
Yeah, well, as it was said, and maybe my colleague Professor Laladi will complete, but as it was well said, the whole world is aging. It's not only the developing countries, it's the low and middle income countries as well, the rich countries, everyone is aging. And as it was said as well, the aging is more rapid, or the numbers are more rapid for the oldest old. So the real booming population are the 85 and plus, and even the centenarians. The centenarians are 300% more than they were 15 years ago. So it's really booming. Now, why is it a challenge? Because it's a good news that we can age longer, but it's not the good news if it's not healthy years. So that's why it has to be healthy years. Healthy, as the World Health Organization defines it, it means functional years, not necessarily without any disease. But the problem is, the challenge is, as we age, and the flipping point is about in the 80s, then there is a major increase in the chronic diseases, including the brain chronic diseases causing dementia. And for instance, in the 85 and plus, it's nearly 40% of the individuals who have cognitive impairments, which is a major problem. So the challenge is the same, the culture is not the same, and the solutions do not have to be the same. But I think we can be inspiring ourselves, both sides, the rich countries to the low middle income countries, and vice versa. The challenge for the rich countries is, of course, how to control the costs, because everything is institutionalized. So long-term care facilities, how to have a better transition in the trajectory of chronic disease, how to support this, and how to have the right health professional and health workers. In the low and middle income countries, it's more or less the same challenge, but the culture is very different, and there is a culture of a more greater importance and role for the families and the proxies. In that sense, the trajectory is currently less institutionalized. However, in low and middle income countries who are taking a lot of the culture of the Western countries, such as China, while for instance in China, because of the one-child policy, there's very few family. And the one child of the older parents typically do not live in the same city or village than the parents. So the question of the caregivers and the role of the family will be extremely brutal in countries such as China, for instance.
How would you describe the situation in India when it comes to elderly and dementia care?
So traditionally, families take care of older people, and that is a cultural. It's in our culture, yes, but I think it's changing now because women are going out to work. It used to be the wives and the daughters-in-law who used to stay at home and take care of people. So I have patients who have 5 sons, and therefore they have 5 daughters-in-law, and none of them work, and they run the homes, and they have a very nice way of sharing care. So I know families like that, where every 2 months this man stays with one daughter-in-law and with one son, and there doesn't seem to be any burden apparently on that family. But this is a small proportion, because now increasingly women are going out to work and there is nobody to take care of older people.
How many percent? Do you have any numbers when you say an increasing number of women do work?
I don't think there are actual numbers, and I think the thing about developing countries is we are a society in transition. We are transitioning so rapidly. So if you look at the older generation, they had better physical activity levels, their diet was much healthier, and they had less stress and less metabolic syndrome, less obesity. So they're all quite healthy. But if you look at the middle-aged people now who are going to age, they have all the risk factors for dementia. They have all the risk factors for caregiver burden, because again they have 1 or 2 children and they're going to migrate to different places. And in my opinion, I think the epidemic is yet to come to India, which gives us also an opportunity to do something now to prevent it. Since we have the understanding from developed countries that the incidence is falling, prevalence is coming down, there is an opportunity now to induce a behavioral change in our societies to prepare for continuing to take care of our elders. There are some studies that have looked at dementia care, and clearly stress burden levels are huge. It is bringing down one working person's income. It's paralyzing families if there's a person, especially in a village. It's much better because he knows that he's in a protected environment, and there are people there who will take care. And again, burden depends upon how long they live. Our dementia patients don't live as long as they do in the West. But in urban areas, in the small flats where you have one elderly person, 2 children studying for an exam, and a wife going out to work, patient after patient after patient, there is a huge caregiver stress and burden. And this is going to impact our economy.
Can I just stress here that the challenge of dementia is really a woman's challenge first. 2 out of 3 people with dementia are women. We don't know why, and research has not provided the answer yet. And it's not only because in some countries women live longer than men. If you control for this, so there are other factors, and this is something that. But 8 out of 10 of the caregivers are women, and which means there's only 2 out of 10 who are men, and the caregivers in general need support. And the kind of support that was devised, even in the best situation for women, do not work with men. So it has to be adapted. The other thing is that, as you mentioned, as my colleague mentioned, there is this women's sandwich generation where many women are torn between being caregivers for parents with challenges, such with dementia, but on the other side, having to care for their children. And India is a particularly, I think, example of this, because India has the double challenge. There's still a lot of children, and maybe less and less, but still on paper. And there's the aging of the population, so it's a double challenge, I think.
Which leads me to my next question, and we already touched this issue during our conversation in the session, which is. There's also a tremendous lack of healthcare professionals taking care of these elderly people also suffering from dementia. So what could be done in order to improve the situation, in order to get more people taking care of the elderly? Because, as you said, there are not enough family members anymore who are willing to do that.
Well, I would say, if I can, there is a lack of number, but mostly a lack of training of those who are there. Because if those health professionals would be, if the medical doctors, if the nurses, if the physiotherapists, if the speech language pathologists, if everyone would be trained with the reality of the aging population, things would be much better. But we don't know optimally to train them. So we need research on how to best train them. And then there's the workers, the personal support personnel in long-term care facilities. They're absolutely very badly trained, and they should be trained better. And then there's the population. The population has to be not trained, but to be made aware. And that's why there's programs such as the Dementia Friends program, which started in Japan, then was copied in UK. Canada has a program, many countries has a program, which in order to inform the population as well, in order to facilitate the social participation of people living with dementia, because people living with dementia are not always at the end of the trajectory, they're also at the beginning of the trajectory.
What concepts could be taken over from Japan, since Japan is one of the most advanced countries?
So our discussion is not confined to dementia, I presume.
It's to elderly people and dementia, it's both.
How do I pronounce your name?
Joannette.
Your first name?
My first, Yves.
Yves. Okay, Yves.
Yeah.
As Yves stated, you call it oldest old, right? Another characteristic of old elderly is multi-morbidity. In Germany, if you're over 80-year-old, on average is you have 3 to 5 chronic conditions. Okay, which means even if you conquer the single disease, you have 4 other diseases. So it's kind of endless game. But our 20th century's healthcare model is you train a specialist in certain area. I'm a cardiologist, so I was just trained to take care of patients with heart. Even if I really take care of patients' heart, of this elderly, they have tremendous other chronic conditions, so it's not solution of the individuals, right?
Absolutely.
So we have to change the training of a healthcare professional from a single organ oriented specialist to primary care, more holistic type of health professional, from hospital-centric care to community-based health care. But our medical education in Japan still in the 20th century's model. So that is the biggest challenge in Japan.
So have you already started to go for this path?
I'm sorry?
Have you already, has Japan already started to choose this more holistic approach, which you were just describing?
No.
No.
That is a challenge.
Yeah, it's still the
Because
challenge.
we imported modern medicine from Germany, do you remember? Still science
Now the
oriented.
results are
There is an interesting report last year by Alzheimer's Disease International comparing health systems in different countries that you might be interested in. And in fact, the example in one chapter is Canada, because Canada has taken a community-based approach for the caring of people with dementia and other chronic diseases. Instead, contrary to some other countries like France, who have deployed a number of very specialized clinics to take care of people with dementia, but not for of the other chronic diseases. I think here we see that there's different models being tried. I would think that the community-based model will be the one that will be
and more efficient.
yeah.